Hi everybody, it's Dr. D with First Choice Chiropractic here with my lovely assistant Jessie.
Hello.
Today we're going to be going over how to get rid of dizziness, or what we call vertigo. So, Jessie, what types of symptoms are you having today?
So, dizziness, and I think it's on my left side.
Okay, what makes you feel like it's on your left side?
When I lay back on that side, the room starts to spin.
Okay, that's a really common symptom that we call BPPV, which is called benign paroxysmal positional vertigo. It has to do with the inner ear crystallization that occurs, where basically a little crystal gets stuck in the ear canal and doesn't allow fluid exchange to happen properly and makes us a little bit dizzy. So we're going to be using a maneuver called Epley's maneuver to get the crystal to kind of move out of that canal and get that flowing fluids happen again, make that dizziness go away. So since Jessie's experiencing left-sided symptoms, she experienced by laying on the left side or turning her head over to the left, we get those symptoms. It can be the opposite, where we can do the same thing to the right, but we're going to be showing left today. So we're going to start Jessie in a position where she sits on the table, feet facing the foot of the table here. You can do this on a bed or any other surface that you have at home. What we're going to have her do is sit nice and tall here, and we're going to tilt the head or turn the head about 45 degrees to the left side here, or to the affected side. After we turn there, what I'm going to do is I'm going to help her by relaxing her head back into my hands as we drop the head all the way back, and I use the pillow here to get a little bit of extension in the head here also, the head and neck, and I'm going to hold this position for as long as possible. Now, I say as long as possible because when it's a left-sided issue like this, oftentimes this will cause the dizziness to come back. This will make the room spin for her. So this can even cause us to feel nauseous at times. So as we hold this position, we're aiming for somewhere 1 to 2 minutes, but 30 seconds minimum on that. After we've held that position for our 30 seconds, we're going to rotate the head 90 degrees, which is technically 45 degrees to the right now, and we're going to hold this position for somewhere around 1 to 2 minutes. We're going to aim for 2 minutes on these other positions here. Now that we've held this position for 2 minutes, what we're going to instruct Jessie to do is lie on her right side, facing straight sideways. So she's going to turn her body 90 degrees while I support the head here. When I support that, now what I'm going to do is I'm going to rotate the chin another 90 degrees down towards that other shoulder and just gently drop back slightly here. So she's not straining her neck. I'm just going to hold her head in this position for another 1 to 2 minutes. Again, aiming for 2 minutes and seeing how far we can get with it. These positions here shouldn't cause an awful lot of dizziness, so we should be able to make it there. After we've held this for 1 to 2 minutes, what we're going to do is instruct Jessie to gently sit up. I'm going to have her swing her legs over the side of the table, and then come up to the seated position while I support her neck in it. And then she can go back to her neutral position again. This should get the crystal to move out of the ear. Doesn't always happen the first time we try it, so what happens often is we look for her to do this 1 to 3 times a day. We're shooting for 3 times a day and hoping that that will clear that crystal out of there. If we're experiencing it in the right side, but we're actually feeling it on the left, you can do this on both sides. It's not going to shove the crystal back in if you reverse the order in any way. It should be fine to do it on both sides if you're unsure of which side to do it on. There are other things that can cause dizziness. Sometimes what happens is we get locked up at the base of the skull and we're having some different flow issues there. So oftentimes it just needs an adjustment to the neck will help a lot with that also. So if you try this a few times at home and you're not experiencing relief with it, please give us a call at our office at 804-726-6810. We'd be happy to check you out and see if we can help you do this maneuver, or we can do anything to help the neck in any way to help this alleviate in a different way. Thank you.